And when I've done like an elimination plan, maybe to get to the bottom of things, I've noticed how often I would just stress eat. Like I would be stressed out and grab pretzels or something crunchy and salty. And so when I didn't have those as options, it really opened my eyes to my relationship with food, really kind of reset everything.
Absolutely. I mean, I love that you're sharing that you are identifying what's happening, right? And that's the first step, is to say, hey, I'm stressed.
Welcome to Functional Moms Podcast, lifestyle medicine for women over 40. Let's age on our own terms. This episode is for you if you're curious how food affects mood and behavior. Our guest today is helping kids and adults with alternative approaches to mental health through nutritional psychiatry.
We are thrilled to welcome Erin Falco to the show today. Erin is a registered dietitian and nutritionist certified in functional medicine and founder of Root Health Nutrition and Wellness in New Jersey. She is also a married mom with a son.
Erin was able to help diagnose and treat her own son with Lyme disease and PANDAS, which is a neuropsychiatric disorder that can happen after a strep or scarlet fever infection. Erin now helps parents and patients determine root causes of tics, anxiety, ADHD, OCD, restrictive eating, sensory sensitivities, and more.
Thank you so much for coming on the show, Erin. And fun fact for the audience that Erin and I have known each other for a very long time. We've known each other since 2007. And I had to get my internship done, and in order to complete my personal certification, and I did that under Erin's amazing watch, and I was under her supervision and guidance. I say guidance with capital letters because Erin literally taught me so much above and beyond, and it's still continue to practice and use the things that she's taught me today with my clients. So I really want to thank you for that, Erin. So, okay, Erin, thank you so much for coming on the show.
Thank you for having me. I'm thrilled to be here.
Yeah. So we'd love to start with explaining what is nutritional psychiatry, because like for the average mom out there, which includes me, I have no idea what that is.
Yeah. So it's basically using a whole foods approach and also targeting what's happening inside someone's body in relationship to what their neurochemistry is. So there's lots of examples: genetics, epigenetics, where something triggers the neurochemistry. So our endorphins, our neurochemicals, like our serotonin, our happy endorphins, our dopamine, the excitatory neurotransmitters, our norepinephrine, our epinephrine, our fight or flight response neurotransmitters. So infectious triggers, bacteria, yeast, all those things can trigger your neurotransmitters to become problematic and cause some of those symptoms that we see. I'm not a diagnosis person. I don't love labels. So sometimes patients will come in and say, I am referred to you from my psychologist for anxiety, but what really does that mean? So nutritional psychiatry is looking at what are some of those roots to get us to that diagnosis or to the symptoms that they're having. And so we're looking at the whole entire person, not just treating on symptoms and a diagnosis, but we use food. So instead of, one thing I love to say all the time is it's not just what you're eating, it's all about how you're using it. So how do we use that apple? How do we use those proteins? Our neurotransmitters, those endorphins, those happy neurochemicals, are made from amino acids. And amino acids are proteins that we eat. So if something is blocking the protein that we're using for our brain, or we genetically have a SNP where we need a little bit of assistance to use that protein, or simply if we're just not eating enough or we're malnourished, then we're not going to get those amino acids to help our brain do its job. And so they all require, those proteins all require enzymes and other nutrients to help us make our feel-good hormones and, help us regulate our emotions throughout the day. So I'm looking at the whole person. I'm looking at from when they were born, even before they were born, in preconception, all the way to how they're feeling now. Pediatrics, for example, I'm looking at all the pediatric notes. My patients come in with like huge folder of every sickness that they've had, every traumatic event that they had. They tell me their whole life story so I can understand what those triggers are. And then we do a lot of specialized testing to understand what's happening. I feel like a lot of times nowadays, supplements are becoming the new medications. So everyone's like, what do I do for this? And I'm like, well, I don't know yet. I'm like, I need to understand the why first, not what do I take or what do I eat. I
Right.
need to understand the why first, and then we can kind of go from there.
Yeah.
Wow. So this sounds something very new to me because typically when you think of brain disorders, mental health issues, you're not always looking at food, or traditionally doctors aren't going to really recommend that you do that. So tell us, like, how long has this been, nutritional psychiatry been happening?
For decades. It's just that we're starting to learn more about it, I would say, over the last 10 years. And you guys are seeing a movement into functional medicine, of course, but
Yes.
it's been around for decades. It's just that, and we know that in the regular medical community, even in my training, like I, as an RD in the hospital in clinical rotations, like I didn't learn this information. We learned acute care medicine. It's like, okay, this is what happens when a patient has gastroparesis. This is what you do, right? Or this is what you do when a patient has, diverticulosis. We don't ask the why. Well, why do they have diverticulosis? Or why do they
Yeah.
have these other things going on?
Right.
And
Right. How did it get that far?
yeah, why are we at this place?
Right.
And it's like that Band-Aid approach. And it's like, okay, well, this is what you do. But it's like, okay, that's great for now to help us with the symptoms. But
Right.
let's go backwards and figure out how we got here.
Wow.
Yeah, well, this is very exciting because we've heard a little bit, yes, in the functional medicine world, you're starting to hear more and more about this looking, and of course, functional medicine is very big on looking at food. But tell us a little bit more, I guess, about your process. Like, say, for example, like I have a son with ADHD. Like, if I wanted to look at how, there are ways we could help him, like, where would we start?
Yeah, it's one of my favorite, and I put diagnosis in air quotes because I always want to think about the brain as just being wired differently. Everyone's brain is wired differently. Everyone requires different nutrients for the brain to regulate. And when we talk about ADHD, it's just that those chemicals, those neurotransmitters are getting mixed up, right? So we need to figure out, well, first I usually go through their whole family history. I like to understand infections and viruses because a lot of times those can trigger those symptoms, right? And also when we talk about ADHD, there's different types, right? What's happening? Is this person have impulsivity? Is this person have difficulty focusing? There's lots of different ways to describe what might be happening, but essentially I'll look at the past medical history, infections, viruses, and then I'll look at genetics. Of course, that's a factor, but I always start with the gut. So I'm always I do a stool test, and then I do something called a urinary organic acid test. And what this looks at is what's happening inside the gut. Is there any bacteria, yeast, mycotoxins, molds? And then it also looks at how our body is using our fuel. So how does your body break down and use carbohydrates, proteins, and fats for fuel? Usually there's lots of SNPs or coenzymes or things that help us to make the nutrients. And as an example, when we're eating our protein, we all need keys to get that protein to get inside for the nervous system to relax. So it's kind of like you're standing outside your front door and you need a key to get in, right? You need a very specific key for your front door. Everyone's key is different. So I'm looking at what keys are going to help to get that protein inside for their nervous system to do the job. And with ADHD, a lot of times that can be simple things like B6. B6 requires magnesium and zinc. So all those work together. We can't just give them one thing. We have to add other things to help those enzymes work for the nervous system to do the job and get the appropriate connections. ADHD is a mitochondrial disorder. Mitochondria means energy of our cells. And that means just taking the food that we're eating and using it for fuel. So again, when I was talking about earlier, how it's not just what we eat, it's how we use it. That's everything. So how are we using these nutrients?
Yeah. And it sounds like it's rather complicated because, like you're saying, you can't just take one supplement. You have to look at everything. Yeah. Together.
No, actually, it's like my least favorite question. And we have a patient application when patients call in. We do a discovery call to understand, like, how can we help? And what are some things that you're looking to get out of our counseling sessions? And they're like, oh, I just want a meal plan, or I just want you to tell me what to do with this. And I'm like, well, I'm not going to tell you what to do. I'm going to ask lots of questions about why first, and then we're going to go from there. Because anybody can go on a diet plan. Anybody can take out foods from their diet or add things in. But like, is that really specific to you as an individual or your child as an individual?
Wow. Anxiety is also a very common thing with kids, teens, and adults.
Everyone. Yeah.
I can attest to that. Can you explain how getting what the process is similar to getting to the root cause of this?
Yeah, I mean, we want to look at lifestyle factors, of course, and then also environmental factors, and then learned experiences and also trauma. So we're not just asking about, how the food is used for our body, anxiety or stress, but we're also looking at how we're coping with, could be old triggers. So maybe there was something that might have happened when you were younger or any time in your life that's a trigger that keeps getting reactivated, and that's what that is, right? So it's like you're walking across the street, as an example. You're walking
Sure.
across the street and a car is about to come and your body gets into fight or flight and it does its job and it, gets you out of the way. And then eventually, like, you go down that same street and you're like, oh my God, like, you don't know why you're feeling anxious, right? But your body is responding. And that's usually because it's an old trigger. It's traumatic, right?
Right.
We don't think of trauma in like these small examples. We think of trauma in a lot of different ways. But what I've learned through working with a lot of therapists is, and I've learned so much through them, is that trauma can constantly reactivate those symptoms that we're having. From a neurochemistry standpoint, we want to try to get the body regulated so it feels relaxed throughout the day, but we also need to understand what those triggers are. So it's learning about yourself and your child to understand where is it coming from. And again, it's asking the why. Okay, well, why do we feel that way? And what does it actually feel like? Because anxiety is a term or a label, right? But what does that actually mean? Like, are you sad? Are you mad? Are you angry? Are you, right? Or what, and where do we feel that? So it's kind of, there's a lot more that, goes into it. And we want to be able to learn about ourselves, learn our triggers, and then understand, like, how do we cope? And again, it's not just taking something to help you cope. It's learning about the whys underneath that.
Right. So would you be like working then like with this person, let's say, like on a nutritional value as well as like, like they're doing like therapy, like how does that person's approach look like and how he or she's being helped?
Yeah, so I always like to look at blood work to understand maybe some things that could be triggering that. A lot of infections and viruses can trigger those unexplained symptoms. That could be part of it. And then, of course, we want to learn about their history and then, when they're feeling that way. It's normal for someone to, have a test or something and feel that those feelings, right? But if it's all the time, then we want to really dig deeper. Do we need a little bit more assistance in balancing the neurotransmitters? And so, as an example, you'll look at urinary testing. I'll look at things like iron and B vitamins because those can contribute to some anxiety. And then, of course, like, what are they doing on a daily basis that is keeping them up at night? So yes, we look at not just the nutrition part, what's going on in their life, and then how are we managing the stress?
Yeah, I mean, that's a really interesting approach because I think, again, this is different. It's new. Like, most people just think of traditional talk therapy for anxiety or medication, and they're not thinking about how the role of nutrition can play. And then the other viruses could actually be triggering. It's just a much more comprehensive approach, which is exciting for people because I think people struggle a lot with this. It's hard to get the right therapist, the right care, or the right medication. Sometimes it doesn't always work great. So this is
Absolutely. And then with kids, it's hard because a lot of times they're not in touch with their feelings or can't describe or attach something. They don't know what anxiety is. They just know how they feel throughout the day. And we see it as parents, like they're dysregulated. They're hitting, kicking, punching, they're yelling, they're screaming. And that might be, something is feeling out of control in their body. And that's the way that they are regulating or helping them to de-stress. And we think about it like, oh my gosh, in the old days, well, you would get in trouble for feeling, right? And that minimization of like, okay, you're allowed to feel just like we're allowed to be angry, sad, mad, frustrated, whatever. And we want to be able to talk about that and teach parents and children that like it's normal to have these feelings. And even just making sure that you're validating that for them is part of the process. So understanding the triggers and then also having someone to help regulate that for you. If if your kid falls and he scrapes his knee, instead of saying, oh, just get up, you're fine, right then and there, you just invalidate the fact that like it's normal to feel that you just hurt yourself, right? And actually in the brain, it helps us to regulate right away when someone else can validate that this hurt.
Yeah.
Right. So
Mm-hmm.
there's lots of pieces to what nutritional psychiatry is. It's not just nutrition, but the
Right.
whole person approach to understand what's happening. Actually, one of the reasons why I got into nutrition in general back in the day is I was using food to cope. And I didn't realize it at the time when I was younger. I thought that I was just overeating. And that's the perception of most women. And even for parents, when they come in, they're like, oh, my kid is just like, eating everything that's not nailed down. And I'm like, well,
Right.
let's talk about what's happening before that, right? And when I was younger, I didn't realize that I was eating to help me regulate or relax, right? And then I would feel guilty about it. And then I would be asking myself, well, what do I do? And I would restrict, right? And then I would eat and I would feel bad and then I would do it all over again. But the question is, and now I know this, like as learning through myself, right, is not what do I do with this? It's allowing myself to know that it's normal to regulate. We all need something to help us relax and regulate, and giving myself compassion to say, hey, like this actually is serving me right now to eat all this stuff, right? And it does serve a purpose. And just to learn about for myself in general is a big part of the process. And also just for other people out there who may feel guilty about eating certain things or, have these behaviors where they feel out of control. And it's like, wait a second. We can use this as one of our coping mechanisms. It doesn't have to be all of them, but it can be one so that we can stop that vicious cycle of guilt, shame.
Right. I think also another huge thing that contributes to these vicious cycles, and like what you're saying, is like the food industry that literally have scientists making foods to make you have it's like you're on heroin, right? Like it's crazy. And then when we talk about like triggers, you could notice like a kid behaving a certain way and then they go through the fast food drive through and then the kids after eating is behaving in a completely different way. And it's like he became possessed. And it just makes me think of our last guest, Zen. We had Zen from Moms Across America.
Oh, cool.
And she had that huge list of all the stuff that's in the fast food, like drive-through industry.
Mm-hmm.
And, it's part of the whole vicious cycle. Like just have to watch your back in so many different ways for yourself and your family.
And you brought up a good point because there are certain neurochemicals that we make. One example would be gluteomorphin. Not everyone makes antibodies to this, but gluten and dairy produces certain neuropeptides. They're opioid-like peptides. So gluteomorphin, morphine, drug,
Wow.
right?
Mm-hmm.
Acts like a drug on the brain. Beta-casomorphin, morphine, right? Acts like a drug on the brain. So in people who make these antibodies or rescuers to these foods, when they ingest them, actually have real cravings and withdrawal effects. So patients that we test and we see that they have these positive, we don't suggest getting off them slow. We have them get off, just cold turkey, because they're going to have a lot more withdrawal symptoms, just like drugs. But it produces, when we think about dopamine, that excitatory neurotransmitter that makes us feel really happy, right?
Mm-hmm. Yes.
That's what happens when we're eating those types of foods that you're speaking of. We get this happy high, and then the body says, ooh, I need more, and I need more, right? Just like a glass of wine, you feel relaxed. And then you're like, wait, I need more than one now to help me feel just as relaxed.
Sure.
And that problem is that your brain remembers that. And it's like,
Right.
oh, I love this feeling. And that's why it makes it difficult to, make these changes.
Yeah, it's like muscle memory.
Mm-hmm.
Yeah, I can see. And it's really hard, I have to say, because I felt when my kids were younger, it was easier to kind of keep a cleaner diet. But as they become teens and they're out and about and everybody else is eating all this stuff, it's been a lot harder. And I know my son with ADHD has noticed his symptoms get worse since changing, his diet and eating more of that fast food. So, I personally have seen a link, like just in behavior, and he will admit it to you as well, even though he wouldn't want to, he would admit it.
And that's great that he's talking about it. And that at the end of the day, that's the best advice I can give, is allow your children to understand the connection between what's happening in their own bodies. It's one thing to say, hey, make a suggestion. Hey, this is what would be helpful for you, or this is good, right? Or I don't like to use the word good or bad or healthy or not healthy because everyone's body is so different and it also puts emphasis on certain foods. But to encourage them, hey, when you have that, how does that make your body feel? Or hey, do you feel tired? So that they can understand like what that actually feels versus it coming from something external. Because at the end of the day, they're the only person that lives in their body and know what, benefits them or doesn't.
Yeah, that's a really good point. Yeah, so that makes me feel better actually that he has the knowledge, he has to evolve with it and experiment himself. So that's good.
Absolutely. I think it's harder with the little ones when they really don't, that's their normal. We have so much more experience as adults, right? We know more about our bodies. We've learned so much. We know what works, what doesn't work, what feels best, what doesn't, but they don't have as much insight yet.
And so we had another question about just, I guess, a little bit like conventional medicine really doesn't talk too much about how food affects the brain, but functional medicine really goes into that way. So if you could share a little bit about how the functional approach is different. And you've shared a little bit already, but you could just give us a little more explanation there.
Absolutely. I like to talk about B vitamins often because there's a lot of genetic SNPs and the ability to use B vitamins. Now, we talk about where we get that from our food source and our animal proteins. We get a lot from most of our B vitamins from there. And our B vitamins are stored in our spinal fluid. Okay. So if they're not that accurate when you look at them in blood, we can use them for markers for acute reasons, and there's other things that we can look at to kind of determine if there might be abnormal and of course symptoms, but it's all about how our body is using those proteins that we're eating. And most of the time there's either the genetic SNPs and the ability to use it. So everybody talks about MTHFR, but there's so many other ones. It is a very important one though in mental health because it can contribute to, infertility, significant issues detoxing or getting rid of toxins. And then also, the ability to use the other foods for fuel for our brain and our gut.
For people who don't know MTHFR, can you just share what that's about?
Yeah, so MTHFR has to do with two nutrients, B12 and folate. I would say that most people have a SNP in one of the sides, right, from the B12 or the folate, but they're stored in our spinal fluid. So sometimes you could have a mutation, but you could you could be using those nutrients appropriately. One mistake that happens with these mutations or these with the MTHFR in general is that somebody could have the gene, but there might not be a problem with it yet. It might not be turned on. As a simple example, like diabetes, right? Just because you have the gene doesn't mean that you have diabetes, and we're not going to just treat you with medication because you have a gene, right? And I love stressing this topic because a lot of people are like, oh, I have the gene, so I took all these B vitamins. And I'm like, yeah, but that's why you're not sleeping now and why you have more anxiety, because those B vitamins get right into the spinal fluid and they trigger your neurons to give you energy, right? And if we're taking them, we don't need them. That's a problem. But essentially, folate and B12 are extremely important. B12 helps us to use our stomach acid to digest our proteins. And then it's also very important for depression and anxiety. Folate is very helpful to transport other nutrients inside and also is very important for detox. So a lot of people that have more than a few mutations or SNPs with folate are going to have a harder time with anesthesia, with vaccines. They're going to have a harder time detoxing. They're going to have a harder time with just environmental triggers that everyone's exposed to. So while it is important, we don't just throw B vitamins at it if someone if they have those mutations.
Wow. This is so nuanced, like much more, normally and so many people too, we're just taking supplements blindly half the time, You don't know what kind of B vitamins you're taking. It's in your supplement that you have. So, what's your advice for people that are trying to navigate this?
I always test. I don't guess. It's most important too with pregnancy when someone's trying to conceive, because in regular standard prenatal vitamins, they just have synthetic folic acid. Now, if someone has a gene mutation in folate, right, and they're taking folic acid, it's not going to get inside, right? So we were talking about that door before, and you need a key to get in. Well, that's what methyl folate is. Methyl is the key, for the folic acid to be be used. But the problem with the prenatals is that a lot of them have just synthetic folic acid. And we need that for, conception, but we also need that for neurodevelopment for our children. It's one of the most, if the most important nutrient for autism and ADHD and neuropsychiatric disorders.
Wow. So many people don't even know then that what they're taking probably isn't even really helping at all. Is that basically what you're saying?
Yes, it's something that I feel like has come to light over the last 5 years, more so often now. And there's so much more research out with it, which is great, but it needs to be talked about more often for sure, especially with, mainstream, regular gynecologists, whoever they're going to see for fertility.
So is this similar? I think I remember one of our conversations, Erin, and we were talking about the gut health and how, there's all like these probiotic, supplements. And I think I'm trying to remember, I think you were saying something to me like, and I think it kind of went over my head at the time, but I think you were just saying something like how, well, you don't know like what the deficiency is. So, you can be taking something and you don't need that. You're getting, so that's a similar thing, right? I would think like getting tested because
everyone requires different nutrients and in different forms. With the gut, it's very complex in that we all have good and bad bacteria. It's whether the bad guys get overgrown or not, especially if we've been on a lot of medications or antibiotics where we're pulling out all the good guys. But I don't like to go in blind by just, patients will ask me, oh, what probiotic take? And I'm like, I don't know yet. I'm like, we're gonna have to figure that out. If you give someone a probiotic, it can actually overpopulate. If they already have GI issues or, bacteria or bloating or something, they can overpopulate the bacteria that they already have in there. So it's always like, we always start with food first for sure. And then if they're really having difficulty, there's specific strains that we use for certain things. And then we of course learn about what's actually happening in their GI tract so that we don't make things worse.
Yeah, I can attest to that. I have had IBS and issues like that. And I've taken probiotics and had horrible experiences with them where I was just even more bloated, more miserable. So I that's for real. You have to be careful with that. But people just think, oh, probiotics, that's good. Let me take those, so I get it.
Yeah, the gut and the brain connection is, we now know there's a bidirectional communication between the gut and the brain. And all your neurotransmitters and neurochemicals are made in the gut. Like 70 to 80% of your immune system resides in your gut. And we talk about the neuroimmune system, right? Our nervous system. So if your immune system, there's something going on with that where we're constantly getting sick, we constantly have a lot of GI issues, we're not going to feel well here. Of course, we're going to have anxiety or depression or all those other symptoms or diagnoses that we come in for.
Yeah. In light of what you're saying, like when I am currently right now, as we speak, doing a fast, I'm doing a fasting.
Mm-hmm.
And I don't know what your feeling is about fasting, but however, I was telling Kristen, I was like, well, I just personally feel like my body's like, you need to fast because like just recently I've been getting all these like ridiculous urges for like the worst stuff. And I'm like, wow, I think I need to fast. I feel like I need to clean out house. I feel like there's something going on and I just need to like cleanse myself. So I'm just doing a water fast, and I take some minerals and stuff like that. But what's like, do you feel like I'm on the right path with that?
So I know I always get these questions and I'm like, well, I'm always going to ask more questions in relationship to that. That's normally what I do. But I do think in general, if you live in your body and you know how you feel, and if you're feeling like something is off, listen to literally to your gut and give it a break, right? It can be helpful for some people to give the digestive tract a break, right? And it sounds like that's what you're sort of doing right now is you're giving your gut a break.
Yeah, I do feel that way. And I do feel like it's weird, like, because I've done this before and I historically do feel way better and I don't have the cravings like I would have them. But it's interesting because I'm noticing in this conversation that we're having that I'm starting to say, oh, I think some of these cravings may not even they may also just be like a mental craving, like when you're saying like, yes, an emotional connection of feeling better, of like, oh, okay, well, what am I going to do do instead, right? Like you create these associations. And I think that's another great thing about the fasting too, is that, I'm like, wow, am I really hungry? Or
Sure. Yes. I've found that same thing with fasting. Like I've really started to question. And when I've done like an elimination plan, maybe to get to the bottom of things,
Mhm.
I've noticed how often I would just stress eat. Like I would be stressed out and grab pretzels or something crunchy and salty. And so when I didn't have those as options, it really opened my eyes to, my relationship with food, really kind of reset everything.
Absolutely. I mean, I love that you're sharing that you are identifying what's happening, right? And that's the
Mhm.
first step, is to say, hey, I'm stressed. Or
Yes. Right.
I'm, whatever that is, you're naming what's happening. And then you're saying, hey, you know what? I ate those pretzels. And I just think that also, we talk about meeting our physical needs all the time, but emotionally, like we also need to be able to say, hey, like give yourself compassion, because it does serve you. When you have those pretzels, it does serve a purpose in regulating your emotions in the moment. So that is okay. It's when we only have one coping mechanism that it can become a problem, right?
Mm-hmm.
Right.
Yeah.
Wow.
Yeah. I definitely have seen the value in changing things up and doing elimination plans and things like that. And fasting just teaches you about yourself.
Absolutely. And everyone's different. If you feel great, awesome.
Yep. Being mindful of our time today, we would like to ask you, we ask all our guests 2 simple first steps someone could take today if they are struggling with mood and behavior issues, or if their child is struggling with these issues.
So I talked about asking the whys first, right? So if it's the child really trying to like look at a pattern to see where some of the mood dysregulation is coming from. I know that parents will say, oh, every time my child has this, we all know with the red dyes, right? Like, or the dyes in general. Hey, my kid's like circling around. But no, I would ask yourself the whys before jumping right in and saying, what can I do? Like, you are doing a lot by asking the why first. And it's just finding the pattern, trying to figure out what the patterns are. And I usually start with the gut. So like, is your child or you constipated? Do you have reflux? Are we having difficulty sleeping? So asking those questions and learning more about yourself first, and then finding, like, I kind of like journal all of that down, and then
Right.
go from where am I ready to start? Like, what usually we start with the gut. Like if something's going on mentally, we usually start with the gut first and trying to find a provider or someone to help you with that. I hate when people are like just searching online and like, let me try this, let me try that. Really like get to the answers quicker by reaching out and finding someone that can help you with that.
Awesome. Awesome.
Yeah, I think it's just all about getting in touch, right, with yourself or your child, and just really becoming that detective is what I'm hearing, and being your own detective to try to get to the bottom of things and asking the question why.
Absolutely. I think that's like the first step for sure.
Hmm.
Thank you so much for that, Erin. Thank
You're
you.
welcome.
You can connect with Erin on Instagram at RootHealthNJ, or visit her website at www.roothealthnj.com. Thank you so much, Erin, for your time. We loved it.
Thank you
Thanks,
for
Sarah.
having me.
The information provided in this podcast is for informational purposes only and is not intended for the purpose of diagnosing, curing, treating, or preventing any disease. We are functional medicine certified health coaches and not licensed medical professionals. The opinions and advice of guests are their own and also not considered to be medical advice. Always consult with a healthcare professional when making any healthy lifestyle changes. We would love to hear from you. Please leave a comment or review. Email us at info@functionalmoms.com. If you enjoyed this episode, please hit the subscribe button.